Good evening, everybody. We're going to get started in a couple minutes here. All right, it's 8:01. We're going to get started here if everybody can hear me. I want to thank everybody for joining us on the call this evening. I think we have a very exciting talk planned for everybody. We're hoping to go about 45 minutes to an hour. So we appreciate you taking the time out of your busy schedules, especially during this time, to be here with us and learn a little bit more about this technology, and more importantly, hear from some of your peers about how they're using this particular technology in their practices and how they've been successful with it. So thank you very much. With that, we're going to get started. So what we want to talk tonight is about adding practice value using our preventive medicine technology. Some of you may or may not have seen this technology, so I'm going to go into a short presentation on the technology, but we're very excited to be able to have some physician speakers with us tonight talking about the technology. As I said, we have Dr. Andy Feltz, who is an optometry physician. He's a clinical director of 360 Care and On-Site Wellness. We have Dr. Arturo Lizano, who is a regenerative and functional medicine physician. Dr. Edwin, who is trained in emergency medicine, urgent care. He has a general practice now, practicing preventive medicine. And finally, Dr. Laury DiMichaelangelo, who is a doctor of dentistry and a clinical director at Complete Health Dentistry. The presenters tonight are going to be Lawrence Kazan-Cassini. He was a Fortune 500 executive and then had his own practice practicing preventative medicine and corporate wellness. Michael Cook, he was an international entrepreneur, and he's been with Pharmanex for the past 8 years. Ryan Lucci, he was a 5.5-year medical device sales associate, and he's been with Pharmanex for 2 years. And I am going to be doing a bulk of the presentation. I was in medical device sales for 23 years, mostly in sales, but in some product development with some startups and corporate training. So the agenda tonight is we're going to talk a little bit about the scanner, science and technologies, show a couple of studies that show that it's science-based evidence, and then we're going to get to the physician speakers and a Q&A session with the physician speakers. And if we have time, we're going to get into practice integration and some revenue projections if we have time. So one of the things that we're seeing currently is a trend towards preventative healthcare, and medicine in general. Things are changing on a yearly basis. So we're seeing a lot of physicians who are unhappy with being able to practice preventative health and have it be profitable. We're also talking to physicians on a daily basis who are unhappy with reimbursements changing every year, and usually for the worse, and ultimately how these things are affecting their lifestyle and ability to spend time with their family and practice hobbies and things like that. So there's a number of things we can do to improve healthcare. Not only from patients is there a shift to prevention and wellness, but physicians as well. So some of the things that we know are that diets are inadequate. So most of your patients are not getting the proper nutrition. And this is seen in the demand for supplements. It's over a $40 billion a year industry in the US, and it's growing $1 billion a year. And so we have a better solution where we're able to help you integrate this into your practice preventative health by scanning your patients with our biophotonic scanner, getting a baseline measurement, and then recommending a course of care, which is our nutraceuticals, and then being able to re-measure them on a bi-monthly basis and show the patients that the supplements are working and that their health's improving. So it's a phenomenal company, Pharmanex. It's 5A1 rated on the stock market for mid-cap companies. It was rated by Forbes magazine as one of the most trustworthy companies in the US. They invested over $100 million developing the scanner, And they have 75 scientists who work for them full time, and they spend about $60 million a year on R&D. So pretty impressive from a company standpoint. So it's a company that's that does really well. They have about $3 billion in sales yearly. So it's not a small company, and it's a company that you can really hang your hat on and know that they're doing the right things and are not going to embarrass you if you decide to implement this into your practice. So the great thing about the scanner is that it helps with retention and compliance. It's a behavioral modification tool. And then once you recommend the supplements to your patients, them being able to see where they are on the scale of where they should be and where they are, it's going to help with retention and compliance, because those patients are going to stay on the product longer term if they're able to see some results. And if they're seeing results, they're going to be more likely to take the therapy as recommended. So that it's an accountability technology. It's a quick, easy test. It takes 30 seconds to scan a patient. They scan through the palm of your hand. It's portable. It runs on a battery. The battery only needs to be maybe charged once or twice a week. It's cost effective. There's not a whole large outlay of cash to get started. We have a 94% failure rate. We have done over 23 million scans worldwide, and we have a 99% response rate with our supplements. So it's a really exciting thing. So what do the results mean? We want patients to be up here in the 50,000 or above range for optimal cellular protection. But most patients are scoring down here in the 10,000 to 30,000 range. So there's a lot that we can do to help them increase their score and prevent these preventable diseases. So with our nutraceuticals, your average smoker is going to be down here in the 14,000 range, and you're chronically ill, cardiovascular disease, diabetics, things like that. The average American is going to be in this orange region right here. And then our average Life Pack user is going to, after a couple of months, be up here in the green range. And then if you add on another product to our Life Pack, which is called Age Lock Youth, they're going to be up in the blue zone or above, which is where we really want them to be. What's really exciting about what we have is we have a technology that's called Age Lock, and with that we're able to help you practice kind of anti-aging as well through our epigenetic products. So we're able to take 92% of 1,000 genes back to a more youthful expression through the mitochondria, which is very important, and we're able to do that with our Age Lock products. So very exciting stuff. I just wanted to show a few quick journal articles here. So we have one on skin carotenoid score that basically skin carotenoids may effectively serve as an integrated biomarker of health with higher status, reflecting greater food and vegetable intake. And so this has actually been, it is actually more accurate than serum blood testing for this particular biomarker. And then there was another study that came out of Harvard and Brigham and Women's Hospital, where high levels of carotenoids are backed for breast cancer reduction. We have a lot of studies that validate this science and technology from Stanford, Harvard, Yale, Texas Institute of Health, and many others. And we can obviously, when this is over, you can contact whoever invited you to this, and we can get you any additional studies that you require. So with that being said, I'd like to get to the testimonials, because I think that's going to be what a lot of you are here to kind of listen to, and that's our physicians and how they have implemented this technology into their practice, the change that they've seen in their patients from a behavioral standpoint and health standpoint as well. So with that, I'm going to turn it over to Michael Cook, and he is going to kind of moderate the testimonials by our physicians. So Mike, if you could please.
Sure, thank you, Dan. Great introduction, good information. So our first speaker tonight is Dr. Andy Feltz. He's a doctor of optometry, founder and clinical director for 360 Care. It's the largest mobile healthcare company in the US. Founder of On-Site Wellness, successfully implemented this technology in many healthcare practices. He serves on the board for Mission of Sight. It's a nonprofit. He travels yearly to assist the people of Jamaica. And I swear I don't know how he does all this. He's also head varsity basketball coach at St. Francis High School. But he's an amazing individual. Pleasure knowing him. Andy, how are you doing?
I'm great, Michael. Thanks for having us on. And Dan, great job introducing the technology. Thank you.
Sure.
So hello, everybody. As Mike introduced me, my name's Andy. I'm an optometrist in Columbus, Ohio. So yes, I'm freezing right now. It does not look like the scene behind me, but because I live where the weather's horrible, I've decided to surround myself with good thoughts, sort of like my friend down in Costa Rica, Dr. Arturo, who will be speaking next, I think. So anyways, we've been using the biophotonic scanner and the PharmaNex supplements in our practice for almost 3 years now, about 2.5 years. And I just have loved the way it makes the conversations real with my patients. I've been on nutrition focused patient education movement in my practice for at least 15 years, and it never really got me where I wanted it to. I think it was abstract, and it just kind of went right over the patient's head when I would speak about nutrition and how important it was for their eye health and their overall health, and how those things are, intertwined. Nothing exists in a vacuum. So I, now when I speak to my patients about nutrition, I have a score and I have a readout, and they get to see it. It's visual, which is awesome. There's a psychological component to that. Rather than just giving them a number, they see the picture. And I really believe that, as Dan mentioned, it's like a behavior modification tool. When they go to the fridge to get food, that wheel is in their mind, and they can't get rid of that picture. And so it helps guide their behavior. It helps guide their compliance with their supplements. They're more likely to say, oh gosh, yeah, it's time for me to take my second dose, because they want to get their score up. They want to see that progress. They want it to happen, visually. Obviously, as an eye doctor, I think vision's important, but it's not just the physical vision, it's a psychological vision too. So we've just loved having it as part of our practice. The staff loves, it's so easy. It takes 30 seconds. It's easy to test patients. And we've seen great results with the products on a disease management standpoint. We do a lot of macular degeneration testing and treatment. And I really could not imagine treating macular degeneration anymore without this tool. It's required for all of our AMD patients to get tested because it's an essential biomarker for that disease. And then, I'm also passionate about prevention. So having spent a majority of my career in long-term care and seeing thousands of end-stage cases of chronic disease, you get kind of motivated to figure out as a way to help people so they don't end up that way. And so this tool is great, great for that as well. Dan or Mike, you have anything else for me? Is that good?
No, that's fantastic, Andy. Thank you.
Okay, great.
Thank you very much. Our next speaker is Dr. Arturo Lizano. He's the medical director of Lizano Wellness in San Jose, Costa Rica. Arturo is an MD. He's in medical practice for over 12 years, 8 years in functional and integrative medicine, a member of the American Academy of Anti-Aging Medicine, fellow of Anti-Aging and Regenerative Medicine, and American Board Certified Anti-Aging and Regenerative Medicine. Known Arturo now for about 5 years, and it's a pleasure working with him. Arturo, can you hear me?
Hello, Mike. You hear me well?
There you are.
You hear me okay?
Yeah, we can hear you.
Well, hello, Mike. Hello, everyone. Great to see Andy and a bunch of other great friends. And truly an honor to be part of this amazing cast. I'm always very humbled by your invitation. And yeah, unfortunately, it's been a crazy time for all of us, but I guess being here in the tropics is not that bad, Andy. You're right. So a big hug from the tropics to all of you. Hope you're all well and hope you're all warm during these rough times. My 2 cents basically is I met Michael here in Costa Rica, in my country, about, 5-6 years ago, maybe more. And not only did he introduce me to something amazing, which is all of this that we're going to be talking about today, we have become really, really, really good friends. Mike is like a brother to me. So I have gained so much more than just expertise or great technology. For me, it has been tremendously important. I'm MD. I went to med school here in Costa Rica, and then I trained in the States. And I think the most important word always for me is accountability. Because when I'm not going to repeat a whole bunch of boring stuff. You guys all know that we go to med school and we're not trained in nutrition. We don't know much about nutrition. We don't really say very intelligent things about nutrition during our time during med school, and much less during our medical practice. So for all of us who did study medicine and who truly believe in the power of nutrition, it is kind of hard to be able to explain to our patients why this is so important, right? And when something as important as the scanner shows up with such an amazing lab like Pharmex and all of these guys, to be able to validate what you're trying to tell your patients, it's just truly amazing. Because when we go to med school, we're taught that we have to be science-based, right? That everything that comes out of our mouth has to be proven with evidence, has to be science-based. So sometimes, even though our patients believe in what we say, we need to prove it to them. And it's important, right? It's very important. So getting to know this amazing company and being able to work with the scanner and with such amazing supplements, and knowing that it's all science-based, it just makes everything so much easier, so much more fun, and so much more real. And for me, that's really, really important. I like training. I've done sports all my life. So now I'm having more and more patients that are, who like to train triathlons and marathons, and a lot of some athletes. And these guys think they're amazing, right? They think they're doing really well. They think they're super healthy. And sometimes not so much. They forget that training that hard is also takes a tremendous toll on their body. So to tell someone who does Ironman triathlons that they're not doing too well, they're not going to listen to you, right? It's hard to quote unquote convince them.
Dr.
And when you use
it on.
I'm sorry? All good?
Okay. We'll send you the recording.
Hey, Lawrence, can you please mute?
Oh, sorry about that. I thought Lauren. So anyway, I got sidetracked. I'm sorry. I thought Lawrence wanted to say something. So anyway, long story short, for me, this has been amazing because it helps me in many, many ways, as I know it's going to help all of you. And the most important thing is that it's real in the sense that it's got great intention. I know we all want business, but I got into medicine because I want to help people be better, be in a better position, be healthier. And every time I find a new tool or something that can help me help others, that for me is very important. So for me, Arturo, being able to work with the scanner and the supplements and all this, and knowing that I am being able to help others be healthier and lead healthier lives, then that for me is the most important thing. And that's really what this is all about for me. And hopefully that I can bring that point across to my patients and to my friends and my family members and all you guys out there.
Arturo, it's Dr. Feltz here. I'm looking forward to coming down to Costa Rica in the winter. Hey, I just want to thank you for making me feel guilty because I did it for the money. No, I'm just kidding. I'm just kidding. No, I think that we all want to make our patients get themselves to a better place, right? And some are doing great, and they want to achieve even that high level. Those people that you talked about that want to participate in triathlons or want to perform at their even to that excellent level. And some want to manage a disease state to the best they can with natural means, and some want to prevent disease. So and as physicians and healthcare providers, we want to help our patients through that journey that we want to take them where they want to go.
Amen. Amen. At the end of the day, and I've always told my patients and my family, and I'll tell you guys, you know, I want to make money. God knows I like traveling to the US and traveling around the world and living a good life. So, but that's not the reason why I get up every day. And to each his own, right? We all have different priorities in life. But to know that doing the right thing can help me financially, wow, then that's huge. You know, to be able to go to my office every day and to help others be in a much better state and get paid for it, that's pretty darn cool. But I just want to be able to transmit that now in such times of you know, we're going all through a lot of time of, I don't know, fear or you know, there's so much going on in the world right now. And at the end of the day, like I tell my patients, who'd have thought, right? The most important thing right now is who's healthy and who's not. And there's not a lot of money that can really help you with that. So if you are able to educate and train and teach people and your patients especially, and I do it with my family, you know, I practice what I preach. I've been on the supplements for over 5 years. My dad, my father's a physician, and you know, he believes in all this. My mom, my brothers are into triathlons and marathons, and I can go on and on. Don't want to bore you guys with this, but I just want to show everyone and let everyone know that this is important for me, and I really want to be able to have all of you understand that this can be something really, really important for all of you to transmit over to your family members and patients and everyone around the world. Right now, the most important message is we all need to be healthy. How you want to do that, you know?
No, you're right, Arturo. And I just wanted to ask you, I'm gonna say something that I've sent more studies to you on the device and the product than anyone. I think no one's demanded more science than you, and I mean that's very important, and I understand that. And was it actually going to the symposium at our laboratories and headquarters that really changed your train of thought on this, or where were you at when you became a true believer?
Yeah, so I suggest that all of you believe in this quicker than I did. I was and have been a little stubborn, and it took me a while. I was just poorly trained in that aspect in med school. You know, you're evidence, and sometimes you don't need that much evidence. And so for me, being able to travel to Utah and seeing with my own eyes, you know, the scientists, to shake their hands and to meet them and to be able to talk to them personally and not through an email, and to be able to see the lab and see the monstrosity and see the, you know, the technology they have, and just being able to, you know, put a face to everything was pretty impressive. I mean, that was when I was like, all right, Arturo, stop asking so many questions. Hands down, this is it, you know, just get on it and do something good with all of this. So yeah, going to Utah for me, who had been very stubborn for many years, it was very, very important. So if anyone can go, hopefully after all of this passes, then yes, for sure, I truly invite you to go, because that's a game changer. That makes a huge difference.
Yes, it does. It does for everyone that attends. So thank you very much for speaking tonight, Arturo. And as you said, we're like brothers. We've known each other a long time. Got a lot of respect for you and what you do. With that,
Thanks so much, guys.
Yeah. With that, I'd like to bring on our next speaker, Dr. Ed Dean. He's in Naples, Florida. He's a graduate of Cornell University and Cornell Medical School. He completed emergency medical residency in Los Angeles County. A board-certified emergency medicine, past fellow at the College of Emergency Medicine, and past clinical instructor at the U.S. Medical Center and the University of Miami. He's authored 4 chapters in leading emergency medicine textbook. Clinical experience includes emergency medicine, urgent care medicine, travel medicine, general practice with an emphasis on preventive medicine. And his past experiences include medical missionary in the Amazon. He was a cruise ship physician, hypobaric chamber physician treating scuba dive injuries. And he's currently the director of Edwin Medical Wellness Center and Heart and Health Screening, which provide comprehensive wellness services. I've known Ed for many years, and he actually introduced the products to me almost 8 years ago. Ed, how are you doing?
Can you hear me?
Yes, we can hear you.
All righty. Well, listen, it's a pleasure to be here with everyone tonight. Down here in Naples, Florida with Mike. A little bit about myself. I practice emergency medicine, and I want to tell you all how I brought the scanner into my practice and why. I think it might help some of you that are looking at the scanner and considering it, to be a part of your practice. So 12 years ago, I made a big shift in my my practice. I went into more of a preventative medicine, and I tell you, as an emergency physician, I pumped on too many 50-year-old chests, and even if you resuscitated, everything's really a little bit too late. So I really wanted to focus on cardiovascular risk assessment and risk reduction. We do a lot of imaging tests like the CIMT, CT scan, and it's well proven that healthy diet, healthy lifestyle, healthy weight really reduces your cardiovascular risk. So I became very interested in doing, assessments on people to try to improve their diet, improve their nutrition. And I started off doing these long assessments, and they were just time consuming, spent too much time on this. So I ended up hiring a part-time dietitian, and this was back in about 2011, 2012. And very interestingly, in November 2011, I was introduced to the scanner. And at that time, I had just started using SpectraCell, which is an intracellular nutrient testing. And I was finding all my patients were deficient. And so I went to a couple colleagues that were familiar with the technology and using the technology. And I say, guys, what do you find when you do this test? And they go, yeah, everyone's deficient. I go, what do you do? Well, we put them on that supplement. I go, and what do you do next? They basically say we retest them the next year and they're deficient in something else. I thought, boy, that's sort of not really a great game plan. Plus the test costs $300. That was my cost. And we had to send it out to Texas, and it takes about 2 weeks to come back. So again, it was really time consuming, and it wasn't a really great assessment or a motivator because I really didn't have a follow-up. So I was introduced to the scanner in November, and I think I hopped on a plane a week later to go out to Utah to really validate the scanner because I was very curious. And as an emergency physician, you're always interested in things that work, shortcuts to get you from point A to point B as long as it's ethical and legal and it's effective. Anyways, out there in Utah, I not only validated the scanner, but I also was introduced to the scientist that really produced this. And it's interesting, not only do you have a device here that can help people determine what their nutritional status is, but you also have a motivator. And you also have the solution, which are the Life Pack, the Life Pack Nano, Life Pack, and the Youth. And I've been using those products on my patients for 8 years. I've had a scanner in my practice for 8 years. Very effective, very fast nutritional assessment. Interestingly, Dr. Oz, back in, I think, May of 2011, did a show, and he scanned all his guests, and 94% of them scored suboptimally, and a total of 75% actually scored in the lowest two groups. So I basically come to the conclusion that everyone has micronutrient deficiencies, probably primarily because of modern farming practices. We fertilize, but we don't put back in the boron, the selenium, and all these micronutrients. And all these micronutrients are super, super important for your overall health. And so for all my patients, I tell them, look, if you're serious about cardiovascular risk reduction, you need to supplement with a good supplement. And I do use the scanner very effectively to help them sort of get an initial assessment and motivate them. And even ones, I have some people that come and they scan fairly high. I usually suggest to them that they consider, taking a supplement that has been designed by over 100 PhD scientists who reviewed 800,000 articles and have a form of a supplement that's highly absorbable, has all the right nutrients in the right form, and also has the guarantee. So that's sort of my Pharmanex story. I've gotten away from sort of the business aspect of it. My intention was never really to go into this for the business, but I've started 2 other wellness clinics and an aesthetic center in the last few years, and it sort of has sidetracked me. But it's interesting in these times when my aesthetic centers closed down here. Mike reached out to me here in this time, and I have this big organization that's with me here, that Mike has sort of put together. So I think that's part of the beauty of this type of marketing strategy. Back to you, Mike.
Sure. Thanks, Ed. Yeah, it's nice to have that residual income, especially in times like this. And you said 94% failed the test. That's true. About 80% will get a D or an F on it. That's from the Standard American Diet, or the SAD diet. Only 6% actually get above what we consider deficient. I want to ask you a question. I remember you had run some tests on arterial age. Have you got a moment to touch on that and some of the changes that you saw implementing the scanner and the products?
Well, yeah, it's one of those things, we go at this from all different angles. We do inflammation optimization, cholesterol optimization, hormone optimization, diet and exercise, and nutritional optimization. But I can tell you that we look at the CIMT, which for people that aren't familiar with that, it's actually looking at the thickness of the carotid artery, and you can determine somebody's cardiovascular age. And we're able to, in the past 7 years, take people from anywhere, reduce their vascular age anywhere from 5 to 10 to 15 years younger than their chronologic age. And I have some people that come in with pretty decent carotid artery ages, and some people that come in with terrible carotid artery ages, but we're really able to improve on almost everybody. And I do believe that proper nutrition and supplementation is very, very important in that process.
Thank you, Ed, for speaking tonight. You're very insightful, and I know that I remember when I first scanned with you, you had the Generation 2 scanner, and of course we're on the Generation 3 scanner now. So you've been doing this for a while, and your experience is very helpful. Thank you.
You're welcome.
So next I'd like to introduce Laury DiMichaelangelo. He's a dentist. He graduated from Ohio State University with an undergrad studies in food science and nutrition. He's been in dental practice in Ohio for 35 years. He's grown his practice to 3 locations and 6 doctors. And I will say that dental is one of our fastest growing segments right now. And I'll let Dr. Laury talk about that.
Thanks, Mike. So I'm here tonight with my son, John. He's a senior in dental school as well at Ohio State. My alma mater, went to school there for 8 years. Graduated from Ohio State. I did a year residency in hospital dentistry, and then came back to Columbus to practice. And I also practice in Columbus. I'm blessed to have Andy as my neighbor and mentor in Pharmanex business, and awesome, my best friend actually. So, he's a super guy, and I've been very fortunate to meet everybody that I have met through the program. So, Andy. So yeah, it's been really fun and very interesting. Kind of like some of the other speakers have spoken about. We don't get a whole lot of nutritional information about. I mean, we learned Krebs cycle and how metabolism works and all that. But as far as a functional implementing part of our practice, we don't get a whole lot of that. And it's really ironic that in our profession, compared to others, I mean, it's a nutritional. Our disease process is a nutritional problem. One of our number 1 culprits is sugar. Right? So if there weren't processed sugar, we would have a whole lot less business in our profession. So it's somewhat ironic that I have nutritional and have had nutritional counseling, from my first day in practice. But it wasn't necessarily addressing full nutrition. It was addressing how the etiology of decay works, which has a sugar basis over, carbohydrate basis. So it's really kind of fun to actually shift gears and say, okay, look, giant step back. The person that brought you, God bless you. that the person that brought these teeth in has to be cared for, and that person is going to be assessed through a through a nutritional test. So the scanner's been very functional for us in that regard. Our two disease processes are that we focus on, and the reason why dentistry is focusing on the scanner is because of periodontal disease, which is prevalent in 92% of our patients, or 42% of our patients coming in, and because of the high and increasing demand for dental implants. For a dental implant to be successful, we need to have bone health. Bone health and nutritional wellness are totally connected. So it's been really nice to be able to know that when we care for folks for those two disease processes primarily, we're addressing it from a health and wellness standpoint. One of the sayings we have is your mouth talks to your body, which we have been professing, for a long time. But it's also true that your body talks to your mouth. So if you just make their mouth well, you need to have a body to help perpetuate that. So, John, do you want to say anything in addition to that about, we've used the scanner in all three of our practices now. It's only been about a year, thanks to Dr. Feltz, mi compadre, and it's been phenomenally successful. We use it every day, and really, in all three practices, we use it a lot. So,
right. Well, my experience with it, I went to Utah back in November, and I had a pretty similar position towards it as Dr. Arturo. He was saying he's skeptical. All my professors are saying you need to have evidence-based facts to implement into practice, and so I was skeptical about applying nutrition because it's not necessarily something that I'm being taught. Although they do talk about the importance of it with so many different dentistry, but they don't say they don't really tell you how to implement it. And so after going to Utah, totally blew my mind with the amount of quality control and the amount of scientists, meeting the scientists, just like Dr. Arturo said, and seeing them present all the science between why their product works and why it's good for your patients, and it was awesome. So I'm all in on it.
He's a quicker study than I had to go 4 times to actually comprehend it. I was like you, Arturo. It took a minute, but
You just wanted to hang out with me.
well, that was a big asset.
Because we went together, right?
Yeah. So,
Yeah, this is true.
And how, Dr. D, how's your team done with the program and the device? Your staff.
Well, that was really cool. That was one of the first things we did. Was one of the reasons that I was so adamant to kind of get involved was because I really care about them. So we employ about 25 employees, and not like Dr. Feltz, he's got a whole bunch more, but it's just a small, intimate group, and I really care about them. And so getting them scanned was super big, and what it did also for them was it made them believers. So they were super excited about getting healthy. One of the things that, I don't know if you guys have talked about this, individually, but not all of our patients are interested in wanting to know and be healthy. And they want to get their teeth cleaned. They don't want to know about nutrition. They don't want to know about other things. And so we separate that group when we ask them, are you interested in this? And if they say yes, we carry forward. But the team is very enthusiastic about it, and sometimes they just can't help but talk about it with them. So it's really fun. It's good. Good. Mike.
Well, in my case, the way I practiced, the way I started using my scanner, I had a huge family meeting and I scanned the whole family. I'm like, let's play a game. And they're all, thinking maybe it's Monopoly or something. And then here I am. I'm going to scan everyone. And I scanned literally, I scanned from my grandmother down to my little cousins. And I scanned that night. It was one night, the first time I had my scanner. I scanned about, I think it was like 28 of us, 26 of us maybe there that night. Yeah. And it got kind of nasty because it got a little competitive at the end. I was like, oh my goodness, my brothers who do triathlons, they're like, oh my God, how can grandmother be doing better than I am? But it was just like a fun way of starting my scanner experience. And I really wanted to, practice using it, not only because I needed to know how to use it properly, but once again, I wanted to kind of prove that, this thing really works.
Yeah.
So, we can all do it differently, right?
Right. Arturo, to that point, during this quarantine, what is super important to every one of our patients and every one of us as parents and leaders in our family is their wellness. Their immune systems are super important right now. I mean, it's #1 topic on everything you hear and see. What a greater way. You see masks and gloves. Okay, I get all that. And we're going to end distancing. I get all that. But how about having in your body a ramped up, totally Teflon immune system? I mean, blueberries, blackberries, absolutely. But your nano and your life pack, for Pete's sakes, don't forget that. So that's kind of where we've been at home. And yes, and measuring and then remeasuring, right? Because we've had Mamacita in our house is like the boss, right? So she started off on her own. She was like, Dr. Feltz calls it a lie detector, or what's your word for that, Andy? What do you call that?
What, the nutritional lie detector?
Yeah, well, when she gets a 52 without taking any Pharmanex.
Oh, the test is agnostic. So I love it when people test high when they don't take Pharmanex supplements, because it proves the test is agnostic. It's not a Pharmanex detector.
Right. So mom scores a 52 right off the bat, not taking any supplements. Well, guess who got down to like a 43, and we all screamed like, "Oh my gosh, come on, kids, we'll share. You can have some.
Right.
Don't let that number fall now." Right. So
especially now that I beat her with the 55.
Yeah. So
oh, Johnny, nice. Nice.
So I know it's a little off topic, but I mean, for all of us, for Pete's sakes, this is a time for everyone you love. Arturo, to your point, all 28 of yours. We only have 5 in our house right now. It's a little quarantine, but hey, we want all those numbers to be crazy high. So
thank you, Dr. D. One of the things that stood out to me is when I first started this, I spoke with a few dentists, and I was always speaking about periodontal disease. And at the time, I just learned how serious that was, and that it is a systemic disease, and people can have heart attacks. Women can miscarry from that. But I think the real advancement with dentists came with the high rejection rate of implants. Is that one of the reasons bone health, that you're focused on?
It used to be, right? It used to be that you never even got the conversation. You didn't get a consult. If you smoked, you don't get an implant. Back when this is my 35th year, when implants first began, like in those years, wasn't even thought about. It was just, you get up, and not until you quit smoking and you've been off, nicotine for a while, then we'll talk about it. And we got a little, in my opinion, we got a little loose with that. I don't know if it was a matter of just, maybe we felt the products became better and overcome that. I think it's going to come down to that, Mike. I really do. I think it's going to be where we have a whole lot more scrutiny in who we pick. Well, here's the thing. We can fix that. That's not a, you can't make me 6'2" with blonde hair. I can't do that. But you can make my immune system healthier. That's very, so it's a problem, but it's a manageable problem.
Yeah, that's one of the nice things when you can measure something, and when the score is low, you can immediately have a solution for it. Thank you very much, Dr. D. Appreciate your time this evening and all you've done with the device and helping your patients. So that wraps up our 4 physicians for this evening. But we're going to go to a Q&A, and Ryan Lucci is one of my associates that I've worked with for the past year, is going to run the Q&A. He specializes in preventive medicine. He's been in medical sales for 7 years. He's consultant for he's been a consultant for a medical device company before that, and a spine specialist. So take it away, Ryan.
Thank you, Mike, and thank you everyone for being on the call this evening, and to all of our speakers. That was terrific. Dr. Dean, Dr. DiMichaelangelo, Dr. Feltz, and Dr. Lizano, thank you so much. So before we get into the Q&A here, if anybody has to hop off the call, I do want to say if you have any additional questions or you would like some more information, and how to implement this technology into your practice, please reach out to the person that invited you on the call this evening. So as we get into this Q&A period, for any practitioners that have a question, you can feel free to type in the chat your question, or you'll see an option to raise a hand. And that will signal us to unmute you, and you can verbally ask your question as well. So we'll do some questions right now, and then Lawrence has some closing thoughts for us. Okay, so if you have a question in the chat, or you can raise your hand and we will unmute you.
Martin, looks like, Martin, did you have a question? Hold on one second, let me unmute you. You're gonna probably have to unmute yourself, Martin.
Yes. Hello to everyone. I'm from Argentina, and I would like, if you, for the dentist, if you can give me the 5 key points. Why do you recommend this technology?
Okay.
In a short way.
Sure. Overall wellness. Are you talking about for my patients or for me personally? What was your? Well,
But
I'll give you.
Which you think is the best way to implement this technology?
Okay.
Dr. D, I think he wants to know what's the number 5 reasons a dentist should do this.
Okay.
Yeah.
Okay. Number 1, for soft tissue wellness, our number 1 disease process is periodontal disease. 42% of our patients have it. You need to have soft tissue wellness. Number 2, bone wellness. It's probably one of the things we have, that the number 1 loss of reason for loss of teeth is also because of the bone that supports our teeth and not being well. We call that disease periodontal disease. So to help fight periodontal disease. Number 3, I think understanding that our patients have an overall, we're healthcare professionals, so their overall wellness, just having all the like we talked about, the micronutrients, the micro minerals, the whole cascade of trying to eat 6 to 8 servings of fruits and vegetables and all that they contain. So just an overall wellness standpoint. And I'll add the last 2, how our country right now is divided both with wellness and business. I'm going to add the last 2 for business. Number 4 is, in our office, it offers a huge income potential for our team, the way we structure our incentives. So it helps to make them, to help to support them financially. And then number 5, if, like in Las Vegas, if the house isn't good, nobody's good, right? You don't have lights, you don't have machines. So it helps keep our business well. It's an income stream. It's not a huge income stream, but it's a substantial income stream. And so it helps with that as well. So those are the 5 reasons.
Thank you very much, Doctor.
Thank you for your question. We have an iPhone that has a hand raised here. I believe they just unmuted themselves, so you can go ahead and ask your question.
Hi, Ryan, Tom Lenz.
Dr. Lenz, how are you, sir? Thanks for being on.
I'm good.
Good.
First of all, I just want all the speakers to know I appreciate their time and their insight. And I'm also happy to report that I know Ryan personally. We both live in this lovely place called Hilton Head Island, South Carolina, which is a lovely place to live. Somebody has to live here. It might as well be us, right? So my question is, because I'm seriously looking at getting involved with the scanner, and I'm like, I guess it was Dr. Arturo who mentioned that he was sort of a doubting guy and wanted proof, and that's kind of where I'm at. So my question is, do we have evidence to show that raising antioxidant levels with product will definitely reduce the incidence of cardiovascular events, either morbidity, mortality, and the other issue, of course, with the antioxidants is cancer? I mean, do we see that patients who raise their levels by using product have decreased incidence of cancer? And then, of course, reducing mortality?
That's a great question. There's a number of studies, of course, on PubMed you can look at for those diseases, showing the relationship and the prevention level going higher with antioxidant intake. I don't know.
Dr. Lenz, was it Lenz?
Yeah.
Yes.
Hey, it's Andy Feltz. So when you're talking about outcome-based studies, the two right now that are really easy for me to point to are for macular degeneration and Alzheimer's dementia. In cancer, it's circulating plasma carotenoids. Those studies are quite evident. So there isn't a particular outcome-based study on supplements versus dietary carotenoids. But there is a excellent study on the scanner and breast cancer. And that was from the,
I've seen that.
Okay. And then you've got some, several studies, one out of Harvard, one out of the Journal of Clinical Nutrition on plasma carotenoid levels and breast cancer risk. So, there's not a, 10-year blind, double-blind placebo randomized study on if you take, supplements to raise your antioxidants levels versus eat to raise your antioxidant levels. I think that's what you were asking.
Well, I guess, yeah, I mean, it's so hard to raise these levels with nutrition, with proper eating. Right? We know that. But it's so easy to raise our level with supplements. So have we just not done it enough with supplements? I mean, we clearly show quickly that antioxidant levels can be raised by retesting people with the scanner. So the question is, has not enough time gone by yet with using either diet or supplements?
Let me if I could try to help you with that.
Okay.
So I had the same question, and again, I sort of came from an Ivy League school where, like Arturo said, everything, needs to be proven by randomized, double-blinded, prospective studies. But the problem is you're never going to get that with supplements. Number one, supplements are there to be supplemented, and they're not there to treat disease. So you'll never see a study like this, because otherwise it becomes really a pharmaceutical and not a nutraceutical. So we just extrapolate really from our knowledge of what the antioxidants and all the micronutrients do. And furthermore, a study like this would be a long-term study, and just the funding is not there. That's sort of the other reason. But the primary reason, I asked the scientists out there in Utah the same thing. They say, look, we can't have those studies because then we become under the FDA's regulation as more of a pharmaceutical.
Right. Okay. So you're not going to see these studies. So what are you going to go by in order to know that you've had an impact?
Well, you have to have a leap of faith that, all the studies show that, having, elevated antioxidants in the body, reduce the risk of macular degeneration, cancer, cardiovascular risk, and people just aren't getting there with their diet. So this is the best we can do. In my practice, it's multifactorial, but, we have been able to really see direct imaging of cardiovascular risk reduction. And again, the ophthalmologist, everybody else is seeing the same thing using these supplements. So unfortunately, you're going to have to sort of make your own decision there, but this is the best we can do. And I also do a lot of hormone therapy with bioidenticals, and you have the same thing. There's a lot of studies in Europe and in Australia, but we're never going to see them here from the United States because there's just not, big pharma money behind it.
Gotcha. Okay, thanks.
And another interesting thing too, I just want to point out, is when I went out to Utah, the three guys that started PharmaNex, they are probably some of the most brilliant minds in big pharma that left big pharma to do these nutraceuticals. Joe Chang, Michael Chang, and Gerasi. Michael Chang was the one that developed Mevacor, the first statin, which are probably one of the most blockbuster drugs out there, and really has changed the cardiovascular treatment. Joe Chang did rapamycin and made Rapamune, and again, sort of had a lot of anti-aging properties and a great implant rejection agent. And then Gerasi was the father of the birth control pill. So you have these most brilliant minds that really got together to make these nutraceuticals. And for me, I don't know a lot about medicines and, the formulation of them, but if you go and you have something made by these, brilliant people, I think you can take the leap of faith that they made a pretty damn good product.
Thank you.
And can I add just one thing? There's something that I think we miss. We're always talking about antioxidants, which is great, and it's really, really important because that's pretty much what the scanner does. But there's another very important thing that we also have to remember. These products, or supplements, or whatever you want to call it, they are vitamins, they are minerals, they're phytonutrients. There's a whole gamma of things. And any one of us on this call who has ever taken a biochemistry class knows that biochemistry and the human physiology cannot work properly if you don't have the cofactors to aid that, right? We need zinc, we need copper, we need B complex, we need vitamin C, we need a whole bunch of these things. That's the whole purpose of eating, right? That's the whole purpose of nutrition. So if you don't have a well-balanced nutrition or optimal nutrition, then your biochemistry is never going to work properly. And that's just every day. That's just us sitting down on our couches, much less, running around, which requires a lot more of these cofactors, a lot more vitamins and minerals. We know that just thyroid alone needs more than, 11, 12, 13 minerals to work properly. So if we don't give our body that, then our machine is not going to function properly. So it's not just about measuring antioxidants. It's about understanding that we need all of this really complex composition to be able to function as perfect machines that we are.
Excellent. Excellent. Thank you, Dr. Lenz, for your question. Great question. So we have time for a couple more questions here. If anybody else wants to chime in, feel free to unmute yourself.
Right, it looks like there's a question in the chat.
Oh, there is.
I don't know if you got that or you can see that.
I cannot see it.
Okay, so Helen had a question. Her question was, how does the scanner take into consideration diet, exercise, and environmental pollutants in addition to looking at epigenetics? Will the patient get a genetic profile in addition to a personalized program plan? So
the device is like a storage meter versus an intake meter. So the epigenetics is a different part, and that takes a lot of discussion to really get into. So I don't know if we have time for that tonight, but I'll just talk about a little bit how the scanner, kicks out a score. And then, we need to talk to our patients a little bit about, their diet and lifestyle. And then, if you have a high BMI, if you have, a lot of adipose tissue or fat on your body, that's going to drive your score down from what your intake would predict. If you have a moderate intake diet, but you have a very good lifestyle, to sleeping habits, when it comes to meditation, stress reduction, that's going to help your score. So you have to take, a little bit of all those factors in, and then we want to work on each one of those factors, reducing our blue light exposure at the end of the day so we get, better sleep, having a healthy weight. So fitness and sugar intake, watching those things, and then having supplements that, as Arturo said, are going to be balanced and broad. Many Americans like to take their nutrition similar to a fantasy football team and draft a quarterback and a wide receiver. And as Arturo mentioned, it's not going to function properly that way. You've got to have, sorry for the American football analogy, Arturo. I guess I could use a soccer analogy and say everybody wants a good goalkeeper and a great striker, but you got to have a left back defender or your team's not going to work right. So, and that's what's great about the PharmaNex plans is they put together some foundational nutritional products like LifePak and LifePak Nano that really allow you to make sure you've got a well-functioning team, and then we can stack on top of that focused interventions for either age management, or in my case, maybe for macular health. Maybe for Laury, for soft tissue, there might be the green tea extract. So, there's ways that you can take that foundational score and then layer on top based on patients' needs, conditions, things like that. So hopefully that answers your question.
Well, and also one interesting thing, when I was doing my due diligence on this, I really tried to game the scanner. And it's more like looking at a hemoglobin A1C. That's more of like, a hemoglobin A1C is a 3-month assessment of glucose, whereas the scanner is more of a month and a half, 2-month assessment of your nutritional status. So you can go drink all the antioxidants you want and go in the next day and not have your scan score change that much, because I use the analogy that it's looking at the bark of the tree to determine the health inside the tree. And that bark doesn't turn over that rapidly. So if that helps, it sort of help you understand the technology that the scanner is using.
Excellent, excellent. Thank you for your question. Do we have any other questions this evening before we wrap up here? Dan, are you seeing any other questions in the chat?
No, I'm not seeing any other questions from my end. So if you want to go ahead and wrap up, throw it over to Lawrence and let him kind of close things out, that'd be great.
Perfect, perfect. All right, Lawrence, are you on here? You want to close us with some thoughts?
Okay, well, thank you. And a particular thanks to you guys, all your time and the input. I apologize, I've got a hiccup since 10 o'clock this morning. So it's nothing to do with drink, by the way. And so
maybe you need to have one.
So thank you very, very much, you guys. It's very important. And I think the input of each one of Dr. Andy Feltz and Dr. Laury Michelangelo and Arturo Lizano and Dr. Dean, thank you so much. And Dan and Ryan and Michael, I think we're at really exciting times. And I'd like to quote Dan. He said something a couple of weeks ago, which I thought was very, very profound. Don't waste this crisis. We've got a great equalizer right now. We're all at home. Everybody, half the population is actually sitting at home now, looking and thinking, and they've got the time. They've actually got the time to start looking at where they're going to do, what they're going to be doing, where they're going to be in the next 6 months, the next year, the next 5 years. So it's a time of deep introspection and reflection. And I think it's very exciting because the company's been working on what we have for the last 36 years. And we have all these scientists. Our products are in the PDR. We've got unique, exclusive, patented product, which is the scanner, which we've invested $100 million on. And it's for everybody. And it's all these different specialties. Whatever the specialty of medicine can use this device. I mean, it's something for all doctors. And important is also the fact that for a physician, he tells a patient your cholesterol is 300. It's just a number. But if the patient can see what their results are on a little screen, and as Andy mentioned, when he goes to the fridge, he remembers that little clock he sees of where his score is, it's a visual, it's impactful. So I think that's hugely important. I think right now with this whole health issue, we've had the biggest wake-up call ever. And I think it's extremely valid that we can all look at our health as well as our pockets, because this is a time when many people are actually having financial problems as well as introspection about health. So I just wanted to say that it's exciting times. We've got another probably a month 2-3 weeks, who knows, where we're going to be confined to home. We've got our restrictions about staying at home, but that's wonderful because we've got so much time to be able to study and look and see what we're doing. It's great time to advance to the next chapter of our lives. So thank you guys. Thank you so much, everybody. It's been just phenomenal. Very, very appreciative for your time, everybody. Thank you so much.
Yeah, thank you very much, everybody.
Thank you.
Thanks for your final words there, Lawrence. I just want to remind everybody that if you want to explore this a little bit more deeply for your practice, please reach out to whoever invited you to the webinar. If you know anybody who may be interested in this technology for their practice, we're going to be recording this, so reach out to whoever invited you and we'll be able to get you a recording as well. So thanks for everybody's time. The physicians really, really appreciate the time, spending some time with us tonight and talking about your experience with the scanner. Great stuff. Thanks, everybody.
Good night. Thank you.
Good night, everyone. Thank you.
Thank
Thanks,
you.
everyone. Have a good evening.
Thank you.
Thanks, everyone. God bless.
Thank you.